Hello, my name is Carissa, and I am going to be going over thyroid cancer. Some causes of thyroid cancer is when cells in the thyroid develop a DNA mutation, causing them to grow rapidly, forming tumors. Some of the exact causes of these DNA changes remain unclear. Some genetic causes of thyroid cancer can be about 5% of them being the FMTC, which is a mutation in the RET gene. Another form of genetic thyroid causes is going to be the M2. It's an inherited condition that increases the risk of the thyroid cancer. Some environmental factors can be exposure to chemicals and radiation. This could be like medical treatment type of radiation. Also toxins like pesticides. This can also disrupt thyroid function. Behavioral factors, some can be being overweight can cause the thyroid to, overact, as well as a low diet of iodine. Some of the help of AI, one of the ones that help detect the cancerous thyroid versus non-cancerous is going to be the deep learning models. These can assist in diagnosing cancer to avoid unnecessary biopsies. There was a study done between the months of July 2015 to May 2019. What they did is they took images of thyroid, so ultrasound or CT images of the thyroid and nodules around the thyroid. And what this predicted is the deep learning models was able to predict 87% of the thyroid being cancerous and about 81% of them being non-cancerous. Radiologists took those same images. They were able to detect 82% of them being cancerous and 79% of those being non-cancerous. So the help of AI is helping with this deep learning model. Some of the demographics of thyroid gland cancer, it does originate in the thyroid gland and can metastasize to other parts of the body. It is three times more prevalent in women than it is men. Um, Perfect. Some of the incidents of thyroid cancer, high income countries, particularly East Asia and like North America, have high incident rates. For example, China is projected to have three 310,000 around there cases, while in the US there has been like 220,000 cases. Some prevalence of thyroid cancer in the US, the exact prevalence of thyroid cancer isn't specified, but the 5-year relative survival rate is a 98% of survival. Globally, the prevalence has been rising, especially in East Asia and North America. In 2019, overall, there was about 18.3 million causes of thyroid cancer worldwide. Some of the anatomy of the thyroid gland is located in the front of your neck. It is part of the endocrine system. It can spread to nearby tissues, which include the parathyroid, the trachea, lymph nodes, and metastasize to different organs, such as the lungs and bones. Thyroid cancer disrupts normal function of the thyroid, which is to produce hormones that regulate metabolism, regulate energy, and calcium levels. The cancer usually causes abnormal cells to grow uncontrollably, which would form the tumors that could invade. These tumors can also invade nearby tissues, spreading into the lymph nodes and other body parts. Some common signs or symptoms of thyroid cancer can be a lump or a nodule in your neck, swelling, feeling fullness in your neck, hoarseness or changes of voice, difficulty swallowing or breathing, or pain in your neck. These symptoms occur because of the growing tumor. It can compress your structure like the trachea or the esophagus, which would be why you would have difficulty breathing or swallowing. The involvement of the recurrent laryngeal nerve can cause the voice change. Some long-term consequences, if left untreated, can cause severe complications. This could include like local invasion or destruction of nearby tissues, the spread of the cancer to lymph nodes and distant organs, and potentially obstruct your airway, and which could lead to difficulty breathing. Survival rate for thyroid cancer varies on your type and the stage that you do have. Generally, the prognosis is favorable for the more common types of thyroid cancer, which would be like the papillary or the follicular thyroid cancers. Again, thyroid cancer, the survival rate is about 98%. However, some more aggressive types, such as like the anaplastic thyroid cancer, have significantly lower survival rates. Diagnosis and treatments could be through diagnosis can be done like with a combination of tests. You can go into the doctor and they can do an exam on your neck and feel for any lumps. If lumps are detected, they would do blood tests to test your thyroid hormone levels. Ultrasounds, which would look at the nodules and the thyroid, and then that case, they could take a fine needle and do a biopsy to remove any of the cells of the thyroid for analysis. And radioactive iodine scans can detect cancer cells. Most cancers have a good prognosis and cured with treatment. However, some may reoccur and become chronic conditions requiring ongoing monitoring and treatment. Treatment options include surgery, so you could have the thyroid partially or completely removed. Radioactive iodine therapy, also to destroy any of the remaining cancer cells. Thyroid therapy hormone to like replace the hormones that the thyroid had lost. Targeted therapy with drugs and external beam therapy. With these treatments come side effects, such as like infections from surgery. You could have like dry mouth and nausea from the radiation iodine therapy, fatigue and diarrhea from target therapy, and then you can also have like skin irritation from the radiation therapy. AI models that are being used for diagnosis and treatment. Again, we do have the deep learning model, which is used to analyze the ultrasound or CT images to detect cancer in the nodules. Predictive analysis, analytics, AI algorithm predict the likelihood of recurrence and response to treatment and personalized treatment plans. AI models can also help create tailored treatment plans based on an individual's characteristics and medical history. And these are the references that I used for my presentation. Thank you.